Hi, David Rosenberg here for the Psychopharmacology Institute. In this CAP, or Child and Adolescent Psychiatry Smart Take, we'll take a close look at the cardiac and metabolic safety profile of antipsychotics in youth via a World Health Organization safety database analysis. This is especially timely as youth treated with antipsychotics are believed to be more vulnerable and at higher risk of developing cardiometabolic side effects as compared to their adult counterparts. So the focus of this study was to identify age-dependent reporting of cardiac and metabolic disorders in youth treated with antipsychotics using the World Health Organization database. Specifically, they looked at all reports of cardiac, glucose, lipid, and nutritional disorders associated with antipsychotic treatment in patients less than 18 years of age. And all told, this approach yielded over 4,600 pediatric reports. Nutritional disorders were found to be highest in youth with significantly stronger signals detected in youth than adults when relying on healthcare professional reports. And these signals were significantly stronger in children compared to both adolescents and adults. In adolescents, aripiprazole was associated with non-alcoholic steatohepatitis. And the real advantage of this study is that the findings are based on real-world data and showed a greater risk for nutritional disorders in youth. The authors recommended specific safety profiles, particularly for aripiprazole and non-alcoholic steatohepatitis in adolescents, with cautious monitoring warranted in all youth treated with antipsychotic medications. This is very important given how the rate of prescription of antipsychotics, particularly the second-generation antipsychotics, which have the highest risk for metabolic abnormalities, has so dramatically increased in youth. And the fact that cardiac and nutritional disorders are overrepresented and were found to be more than expected in youth, especially in the youngest population, is clearly of concern. In this analysis, the association with risperidone and obesity was also especially noteworthy, as was the aripiprazole and non-alcoholic steatohepatitis. The above being said, it is very important to note that no causal association can be drawn from this study or any of the aforementioned findings. The study was not designed to identify causality, and there's a huge difference between a possible association and cause and effect. Moreover, a reasonableness perspective is needed. The reality is that the majority of children and adolescents treated with antipsychotics at the appropriate dose and duration and for the appropriate diagnosis can and are treated safely and effectively. When prescribed correctly, these medicines do enormous good. However, they are not without side effects, which can be significant and require close monitoring and vigilance, and being proactive and prepared to intervene promptly. That is, having an action plan in the event of side effects and properly informing the patients, their parents, and caregivers before starting the medicine. So what's the bottom line? This is an important study in a very understudied area and underscores the vigilance, caution, close monitoring we need to do when we prescribe antipsychotics in youth. This doesn't mean we shouldn't prescribe these medicines, but it does mean that they need to be closely monitored in youth who may be especially susceptible to possible cardiac, metabolic, and nutritional effects. So some people will be concerned that antipsychotics are dangerous to prescribe in youth, that the risk-benefit ratio is not in their favor. But again, I say from clinical experience that the disorders that antipsychotics are used to treat, they're chronic, severe, they cause great impairment, and when prescribed correctly for the right diagnosis, these medicines, I believe, do more good than harm, but we always have to be alert for potential side effects.